Hello, I am Kyle Delaney. This is the Healthcare Within CAR, Central African Republic. This is called the Uprising of Modern Health. Again, this is for Communicating to a Shrinking World by Dr. Gregory Smith, the professor. And we are now recording this on November 2nd, but I finished the PowerPoint presentation yesterday. For everyone that does not know, if you did not read my previous work, I spent quite a bit of time living in Central African Republic, so a lot of this information I'm going off firsthand because I work from Department of State. So, moving on, the introduction. Central African Republic faces one of the most severe global health crises. This country is always within the top 10 poorest countries within the world. Therefore, it's always undergoing tons of health crises within the nation, and they're not able to fund, so they always have to reach out to outside sources for help. Within this, we are going to be discussing the political and legal hurdles within Central African Republic. We are also going to be going over the cultural challenges and with feasible implementations to solve those problems. We're going to go over the cultural obstacles for employees and volunteers, and we will go over the integration plan for employees and volunteers to feel more comfortable there. Political hurdles, long history of French and British exploitation. There's also been an ongoing internal conflict and coups. The 2016 UN attack in Bangui, there wasn't too much publicity going on over that, honestly. They didn't cover much of it. I was actually there for it, again, working for Department of State. Rampant government corruption hinders healthcare investment. A lot of the money funding anything to do with healthcare goes straight into the government's pockets there. It's one of the major Department of State issues that we had with providing funds there is the political figures would somehow the money disappear. Inconsistent regulation and weak infrastructure within the nation. And in 2016, the French medical staff were forced to withdraw, and it closed key trauma hospitals within the country. So this was basically the only hospital that they had that could perform serious operations. It was in Bangui, which is the capital of Central African Republic, and they were forced to withdraw in 2016, pull all of their troops out, all their medical supplies out as well. Legal hurdles. It's going to be going outdated healthcare laws. There's no modern telemedicine regulations within the entire country. There's lack of privacy laws like HIPAA or GDPR, which is essentially the same thing as HIPAA within Europe. There's going to be confusion over licensing for foreign medical professionals. There's inconsistent collaboration between international organizations, basically NGOs, anything that's not just government organized. It doesn't have to just be the UN, talking Doctors Without Borders, Red Cross, anything like that. All of the patient data lacks protection and confidentiality. Cultural reception challenges, reliance on traditional healers, mistrust of modern medicine. They're a little old school when it comes to that. Religious and spiritual beliefs often restrict medical care. Family and community decision making delays treatment. They are very cultural oriented there, and they put that ahead of way other modern medicines that we would. Solution to that, educators and local leaders are key to promoting modern health acceptance. So we're going to have to create a pretty strong bond there, along with our educators. So it's going to take a lot of cooperation. Feasibility and implementation. Strong demand for improved healthcare creates opportunity. Partnerships with local leaders, UN, which is United Nations, and NGOs, which is non-government organizations, like I mentioned, Doctors Without Borders. Mobile health clinics and telemedicine for remote access, and then infrastructure upgrades needed for communication and technology. Cultural issues for workers. It's a group over individual, so if you have individual needs, they don't really care as much as the whole group. Deep respect for local authority, but they don't trust the government. Volunteers must adapt to hierarchy and avoid imposing personal beliefs. We need sensitivity training as well. Cultural shock for employees and volunteers. CAR is one of the poorest nations that there are. We have limited modern plumbing and transportation dangers as well. You have to barter for most things there. And distinct local diets may challenge visitors, eating bugs, rodents, things like that. Integration plan for workers is going to be adapting to minimal living conditions, learn basic trade skills for bartering, electrical, carpentry, things like that, believe it or not. Collaborate closely with local workers and leaders, and provide mentorship and counseling to manage culture shock. So, in conclusion to all this, the introduction of modern healthcare is humanitarian and also a business opportunity. As you probably know, a lot of investors aren't going to invest unless they get something back. There's not a whole lot of humanitarians out there. So, success depends on addressing political, legal, and cultural hurdles, and we need to emphasize transparency, education, and collaboration with local government and outside sources. So, all of this will equal to potential to transform healthcare for one of the world's most undeserved nations. Thank you for listening. Have a good night.